All right, Jonathan, thank you. Celebrating 25 years of service of helping first-time moms throughout their pregnancy and after delivery. Children First is a voluntary program where specially trained public health nurses make home visits and provide care to those who qualify. Joining us live is Lori Essery with OSDH to talk about the services and everything we need to know about the program. Lori, good morning to you and thanks for being here.
Good morning. Thank you for having me.
Of course, happy to have you. I mentioned there what Children First is a little bit, but if you can kind of just give us an overview on the program and the services that you provide.
Absolutely. Well, Children First, as you said, is a voluntary program. It is a national model. We call ourselves Children First, Oklahoma's Nurse Family Partnership, and it's an evidence-based national model. Tremendous success all across the country and in Oklahoma, and we did just celebrate our 25th anniversary, so that was very exciting. And the goal, there's a three-pronged goal. First, we want to improve pregnancy outcomes. The second is we want to improve child health and development, and then the third is we want to increase economic self-sufficiency for families.
So let's talk a little bit about this. You said 25 years, you've seen success as time has gone on with the program. Talk a little bit about that and how it's made an impact on the women that you serve.
Absolutely. Well, over the course of 25 years, we've served more than 48,000 families. And, you know, the way the program is set up, it's designed to begin before the 29th week and then move into 2 full years of that child's life. And when a nurse goes into a home, she is there to support that mother. It's very client-centered and oriented, but she's going to assist with health assessments, depression screening, ages and stages for the child. She's going to look at all of those factors, and through that, we help that mom as she's preparing and as she moves on into pregnancy. And so we see the successes we see long term are better school readiness. We see a reduction in child abuse, in domestic violence. We see in the early stages, child wellness checks improve, breastfeeding is initiated, immunizations are up to date. So those are just a few things that program provides and benefits.
So just a lot of really important resources available to first-time moms, right? So this is you do have to qualify in order to participate in this program. What are those qualifications? What are the requirements?
Well, it is geared for low-income first-time mothers. Again, they cannot be past 29 weeks gestation. There are a couple of exceptions. Anyone under 18, regardless of income, they are going to be included in the program if they are interested. And then if someone is past 29 weeks but they have extremely high risk factors, they would also have an opportunity to participate in the program.
So these services are obviously very, very important, but can you give us some insight into why having a program like this is so important specifically in Oklahoma?
Well, if we really want to improve health outcomes, and I'm very prevention-based and prevention-minded, and we really need to start at the beginning. And that is providing support to families, again, at the very beginning, in those early stages. And what a better way than to work with a family, a mom who is a first-time mom, and just give them the support that they need. Also, we plug them into multiple resources, not only within our own agency, but others, and we give them the opportunity to get on the right footing and the right start. And that really sets them up to put them on a trajectory of success moving forward. And that's going to be improvement for their family, for the community, and for the state of Oklahoma.
Perfect. And Lori, before we go, if anybody's watching right now and they want more information, where can they find that?
Well, they're most certainly welcome to contact us at the State Health Department. We have nurse consultants. They're local health departments because we serve all over the state of Oklahoma, 46 counties specifically right now, but also our Parent Pro website is a great resource, and it's just parentpro.com. It offers an interactive map. You can click on your region, you can pull up all the services, not just Children First, that are available to you.
Everything you need to know, and you can find all that information as well on KOCO.com in the Ask the Unknown section, so make it easy for viewers to find that. Thank you again, Lori, for coming in and wishing you continued success with this very important program. We appreciate your time.
Thank you.
We'll be right back after this.